Thank you. Please do take your seats. The last session of this conference will mostly be held in English. We will start it with a few words in Hebrew as well. This session is dedicated to the memory of Professor Dov Chernichovsky. I had the great privilege of knowing him for 17 years and learning from him what is the health system, what is health economics, and ask questions. This is something that really was one of his main features. We are about to issue a book. You can see that it's a great contribution of Dov's family, who is here with us today. The Taub Center has a lot to say about this, the World Bank, the BGU University. And I'd like to say a few words about Dov from my own personal experience. I'll start from the end of our acquaintance. When I got to the Ministry of Welfare and Social Affairs, he came to me. You all remember him, he was from the Council for Food Security, and those who knew him knew that he would always struggle for what he thought was important. But he was a very pleasant speaker. He was speaking very pleasingly to everyone. And it was very moving to me. I met him in the Netanyahu Commission. His traces could be recognized. What would the health system look like? What would be the national health law? Really something invaluable. And today they're still going back to read the Netanyahu Commission reports. And even when he was not in the position of the majority, it's still worthwhile to read what he said. Principles that we're talking about today, the division into regions, regionality. He wrote about this many years ago. He also addressed in many ways the individual versus public. Yes, there is an individual, there is a public sector. How does one maintain a proper mix between the two, proper interrelationship? The hospitals, the interface we spoke today about the community and hospitals, how should hospitals look like, to whom should they belong, the various failures in this field. And this is something that Dov liked to research, and we've seen today some of his diagrams, and we should really take this and talk about it again. The aging of the population, another issue that preoccupied him, and food security. And here, Nadav and this Taub Center continue this mission. Dov trained many generations of researchers in the field of healthcare, and we're also marking the 40th anniversary of the Taub Center. He was one of the first who was working here, even before it was called the Taub Center. His name was already there in the first working group on health issues. And in the Council for Food Security, from its inception until his passing, he has a great share in this, and he really deserved for us to dedicate the last session for him. We have with us member of Knesset Meir Cohen, the Minister of Welfare and Social Affairs. I don't know if you remember that. It was the first week of your term. You came to an event. It was, I think, the first or second government meeting. You came to an event honoring Dov. And I'm very happy that you and your contribution to the Council of Food Security to turn it into a very significant body, and all the budgets that you managed to achieve for it. I'd like to congratulate you for that. And you really pushed this issue. Thank you very, very much. Hello, everyone. How wonderful to have people here of my age. Tomorrow, I'm 67, I just received the senior citizen card. Hello, everybody. Avi, thank you for inviting me. Roni, all the good people that I know, they are an integral part of my southern heritage. And Nir, and we have very, very sadly saw him go from the Ministry of Welfare and Social Affairs. Of course, I wish you success wherever you may be. And I just congratulated everyone, including Nir, who did a wonderful job in our ministry, and wherever he comes, I'm sure that they will all enjoy the fruits of the labor of this wonderful young man. Congratulations, really. If the people of the Ministry of Welfare and Social Affairs were here, they would all tell you thank you. I was mayor of Dimona, that's when I met Dov. And I'd like to say that really there are very few people left of that caliber, of that quality. I have not met many people from the academic world, university world, who would knock on the door of a mayor in the periphery, in Dimona, come in and not ask anything, just to talk. And slowly but surely he really opened my eyes. And I believe that the decision to set up a medical center in Dimona, which would be an ambulatory center and also open 24/7, that was in many ways thanks to his decision. He told me, I would give you ideas and you bring the money. And I said to him, you know, Dov, I'm the mayor. It goes the other way around. I'll give you ideas and you bring the money. And he said, forget about it. You get the money, I'll give you the ideas. And then we met David Mirage, who sat in the audience, and he made auditions. We were not familiar with him. He was sitting in the audience, and they asked every mayor to speak 5 minutes about his vision. And as we usually do in the periphery, the first one went up and he was very sad. The second one was even sadder. And the third was almost catatonic on his way to the stage. The fourth said there's no way that something will happen for the Negev. And the last one, said that Dimona is the best place to live. It has the best education system. And Zionism, a city of renewed Zionism. And what we need is a medical center, because if you're sick in Dimona in the middle of the night, you have to take an ambulance for 40 kilometers, travel 40 kilometers. And if you are in the Bedouin tribes around Dimona, if something happens, they have no way of getting there. And I said, I always seek people who will materialize my dream. And David Mirage came the next day to Dimona. He asked me, by the way, if there is an airport. And I said, yes, there is a landing strip for helicopters. And somebody told me in my ear, he means for a jet plane. And then he came and we built a wonderful center, medical center, an ambulatory center. All the HMOs are parties to that center. We have specialist doctors. You no longer have to go to Beersheba, from a urologist, a proctologist, going upwards on the human body. And there is a center that's open 24/7, everything you need. And that's Dov. So Dov really has many, many merits. Not only in the field of food insecurity, but I think that if there are people here from his family, then most certainly, you know, it's a chapter that I have perhaps not spoken about yet, and it deserves to be mentioned. You know, as far as food insecurity is concerned, ever since I started my work in the municipal world, or being a member of Knesset and a minister in the government, it was clear that these tools that I carry as a mayor, once a month I have to turn into a mendicant. I have to beg for money, for soup kitchens, for the poor people. It always made me very angry and very frustrated. It gave me the feeling of a country that really avert their eyes from the poor people in the country. And I have to say at the outset, the issue of food insecurity, it's not only to give food, but what type of food, to whom to give it, what do you do with it, etc. So the first thing I did when I came into office many, many, many years ago, it looks to me like generations ago. Actually, I mean a year and 3 months ago when I became a minister. First of all, to set up the council once again. And I'd like to thank Roni. Roni, please stand up so everybody knows who you are. So it doesn't go without saying that he undertook that mission, because since I left in 2014 after the El Aluf report to rebuild this council, it's as if somebody thought this was not necessary. And then I went to the Treasury and started fighting. That's how ministers have act. They go to the Minister of the Treasury. First they start with the Moroccan swear words, then it goes to normal talking. But you discover that there too, there are people, all you have to do is come to them with an organized program. You know this story about those Treasury boys who always are against everybody. That's not true. And I have learned a lesson that we do need this national scale project of food insecurity, and we have to raise it from 30 million to 200 million. And they said, we don't have it. And I said that the country is a rich country. The story is a story of priorities. And I believe I explained why it was very important that it be first on the list of priorities. The same goes with all the various civil society associations. And I told them, you will be the soul of the state. And I believe that in this post-COVID period, we are all going to be sitting here and Avi, and think how we are going to rephrase all the social charters. It will happen in Europe, it will happen in America, it will most certainly happen here, where we have to redraft those charters. Well, we're thinking about bringing more money and distribute food coupons. I personally, as someone who grew up in a family with many, many children, you know, nobody knocked on our doors asking us if we want food coupons. So I'm very careful about this distribution of food coupons. I think that there always should be some empowerment, some type of crutches. Well, you have to give them the coupons because people are hungry, but whoever hears people talking and always saying with great pathos and say there are no hungry children. Yes, we do have hungry children. I invite you to take a stroll with me among the Bedouin tribes, for instance, to see it, to touch it, to see it with your own eyes, to touch it, to see the famine, to see the children hungry. And so we assumed responsibility. The budget is a very respectable one, but within the budget, there are some startups, some initiatives that are really groundbreaking startups. Nir can attest to that. Those initiatives should be checked, should be followed. In addition to the Food Security Council headed by Professor Israel, I also set up an advisory board of all the academic people headed by Johnny Gunn. And yesterday I said goodbye with great sadness. We kept meeting all the time to see, to hear, to feel, to plan, to see what we do further ahead, and to make sure that this money is spent in the most efficient manner, and that those food coupons, that each family or each individual would come in to a program of empowerment. So this is just in a nutshell. Thank you for addressing this. It's not something that I take for granted. Slowly but surely, people will understand that there are very few people who address those very painful issues of society in Israel. Very few. And nobody. In 2012, they held a conference. Who wants to be the Minister of Welfare and Social Affairs? Well, there were just two of us, I, myself, and Bougie Herzog, who's now the President of the State of Israel. So quite likely nobody will ask for that portfolio, but I'm really addressing all the good politicians who will replace us. Come in our stead, take this position, and make sure that you keep a watch on this food security issue. Thank you, Neil. Thank you, Avi, for inviting me. And again, congratulations to all of you for what you're doing.
Thank you, Mr. Overva, Mr. Meir Cohen.
And now we'll go back to English and we'll start our last session for today. The chair of the third session is Professor Hagai Levin. רגע, אני לא שומע, אני פשוט לא שומע. אני לא רואה. Okay. The chair of the first session is Professor Hagai Levin, Professor, Chairman of the Israel Association of Public Health Physicians, and Professor of Epidemiology at Hadassah Hebrew University. Professor Levin is an epidemiologist, public health physician, and faculty member of the Brown School of Public Health and Community Medicine. In the past, he was the founder and the head of the specialization program in health and environment, and served in various senior positions in the public health, including in the Army Medical Corps and the Ministry of Health. He is a member of various national and international boards, among them the Scientific Committee of the National Council of Food Security and the World Federation of Public Health Association. And I would like also to ask the other members of the panel, and Hagai, I think you will introduce them later. Just a minute, I'll find the names. Okay, so I want to ask the members of the panel to come, and Dr. Amy Lazarus Yaroch, Professor Roni Strier, as the minister said, the chairman of the Food Security Council, and Gidi Kroch, the CEO of Leket Israel. You are welcome to the stage. Thank you.
Thank you a lot. We look at the half-full part of the plate, those who stayed, the better half, and I promise you a very interesting session about food insecurity, and I'm sure that we also discuss, as we usually discuss, the food insecurity, but also where should the nutritional insecurity come into place. We spoke today in the different sessions in like overall topics, but if we now zoom into the issue of food, it actually, all the different issues that we discuss will now be exemplified in food. And I want also to say that unfortunately, Professor Aron Troen, who is a leader in Israel and globally in this field, and was very important for arranging this session, is unfortunately cannot be with us, so I replace him. Without any further ado, I would like to invite the first speaker, as was mentioned earlier, Professor Roni Strier, the head of the National Committee of Food Security, the founder and researcher of the Interdisciplinary Center for the Study of Poverty and Social Exclusion at the University of Haifa. Roni.
Okay. Thank you for the organizers. I want to thank the organizer for organizing such a session about hot topic of food security, and I want to express my gratitude to the family of Dov and Dov, that I'm sure his spirit is here today, for the pioneering work he has done here in terms of food security, and I hope we will match their expectations and visions. One word about what is the National Food Security Council. The council is part of it's based on the Israeli Knesset law that passed in 2011, that prescribes that the council should fill an advisory function to the Israeli government through the Ministry of Welfare and Social Security. And I have to say something about Meir, because it was a real pleasure and honor to work with him. He has his heart in the right place and was really committed to the issues of food security and welfare in Israel. So, and this is as said, the the council was inactive in the last 2 years, and I'm very glad that I can just keep this institute, this organization, this entity working on these issues. Something about the numbers. Food security, well, we have the last report of the National Insurance Institute speaks about 20% of almost 17% of the families are in food security, 8% in severe food security, almost more than 500,000 families live in food security. Almost a million people in Israel live in food security, and more than 600,000 children live in food security. Meir talked about children in the Negev, and we need to know much more about the rate of food insecurity there, because the actual food security report of the National Insurance Institute doesn't count not the Bedouin population and not East Jerusalem, which is striking. There is a clear relationship between food poverty, food and health. The link between economic and health status is well known and documented in many countries. More income and better education are linked to longer life expectancy and better health outcomes. I want to just mention that this report of Miri Envel and colleagues that talk about 1/3 of the families in food security had at least one member with anemia, and a quarter of the families had a member with hyperlipidemia. Hypertension is present, et cetera, et cetera. These rates are markedly higher than those in the general population. So the link between food insecurity and health is clear. How we define food security? There are 4 pillars, or as Barry said, 4 pathways of availability, access. We talk about if people has the income, the means to buy food and healthy food. We are talking about availability, stability, and utilization of the. However, we have a very known and accepted definition of the meaning of food security, but in fact, the concept is a highly contested and challenged concept. And I want to say, just to show some of this. 5 minutes? Wow. Okay, I will go to the last, but just look at this. This is what is the meaning of just food? Just food can be understood in many, many ways. Just food and not, other services, or just food in terms of that food should be linked to justice issues. So there are complex and multiple discourses of food security. I was just mentioned some of them. The food waste discourse, the nutritional insecurity discourse. As you know, in Hebrew, the national food security is talked about food security, but the logo in English is nutritional security. And I don't think that is casual, this difference. The sustainable discourse, the crisis discourse, the civil society discourse, the welfare state discourse of food security, and the neoliberal discourse of food security. One of the fallacies that we have in Israel that there is no policy on food security, and I say there is policy of food security. And I just want to. I will just run to the last one. I just have all of them with quotes of the different and clashing and competing discourses, but I just want this one. The neoliberal discourse, and tell me if not Israel has a neoliberal regime of food insecurity. Neoliberal food insecurity discourse aims to legitimize dominant policies, practices, and institutional agreements of the neoliberal system in general. Food security initiatives often correspond to neoliberal injunctions for civil society actors or even for the individuals to become actors they have to be responsible for their own health. It prioritizes the role of civil society initiatives to provide food aid to vulnerable groups. These initiatives tend to neglect the root causes of poverty and income inequality. They reduce food security to the individual or the family unit of analysis and intervention. And of course, there is no empowerment of the constituencies that they are served by these organizations. So I think that exactly this is the main discourse, the dominant discourse that regulates the policy in Israel. So what is my vision, our vision in the National Council of Food Security? To lead, I think, a think tank or a process of building the outline for the national policy on food security. And sadly, I received this invitation and request of Meir Cohen to build the foundations for a national plan for food security. And then the government fell, so I'm waiting for the next one. But I think that it's an imperative to have a social policy that in food security that recognize the difference, or combine the different discourses of food security, including sustainability, health, nutritional issues, climate crisis, and waste of food, loss of food. All this stuff should be part of a national policy that is comprehensive and understand and accept the structural policy, the structural roots of food security. So I think that as a researcher on poverty, I thought that poverty is the most discursive, challenged, contested definition and problem. But now that I'm engaged in food security, I can say that this is not less complex than the poverty issue. So I hope to have you, Nadav and Taub, as partners of this process of developing the framework for a future policy for Israel. Thank you very much.
Thanks a lot, Roni. Please keep your questions. We want to first hear all the speakers, and then we can have a discussion on the different aspects. I don't want to discourage, but it said that plans are worthless, but planning is priceless. So at least we are starting this planning process. And yesterday we had a conference at the Hebrew University about science and measurements in food insecurity. And now we are going to hear more about experience regarding the measurements of food insecurity from our distinguished guest, Professor Amy Lazarus Yaroch, and the CH is silent, Executive Director from the Gretchen Swanson Center for Nutrition. And she also holds a Specialist Dean's appointment as professor in the Department of Health Promotion, Social and Behavioral Health at the University of Nebraska Medical Center.
Thank you. It's an honor to be here today, and I appreciate the organizers inviting me. And sorry that Aaron Troen couldn't be here. He is who originally invited me, and just wishing him well. So my background, I'm executive director at a nonprofit nutrition research center. And in addition to that, I've been at the center for 13 years. And prior to that, I was at the National Institutes of Health. So I was on the government side of things in the United States at the National Cancer Institute. And you could feel free to follow on any kind of social media. So just about my center. So the center is an interesting place because people always think we're academia, and I have an appointment in academia, but we are a separate nonprofit that was established. We're actually coming up on our 50th year anniversary, so 1973. And we conduct a lot of research and evaluation. We're headquartered in Omaha, Nebraska, but we went all virtual at the end of last year, so we actually have 39 staff located across 17 states now. So we conduct measurement and evaluation in our own independent research across a variety of topic areas that you could see. And one of the things we do is we serve as an external evaluator for multiple funders. So basically they are able to determine if their investments are having their intended effect.
Is there a problem with
Oh. What happened? It's on the screen here, but it's not. Oh, it's back.
Okay, let's hope.
All right.
Okay.
Thank you. So just an outline of what I plan to talk about today. So I added.
See, there's
Oh, I'm just pressing.
not this one. Back and forth.
How do you go back?
Okay.
What's he saying?
They're saying it's their problem.
Because I thought it was just the arrow button. I was pressing.
No, it's not the arrows. It's not. You're right with the arrows. Something is there. Let's hope it's okay.
All right, let's hope. Don't take away my time yet, please. So I'm going to talk a little bit about federal food assistance programs in the U.S. to give you some context, and then give definitions on food insecurity and nutrition security, which has gained a lot of traction now in the United States, as well as some new measurement domains that we created to go alongside the USDA food security module. And Eric Calloway's there in the back, and he helped design those. And then I'm going to talk a little bit about financial incentives and promoting nutrition security through those, and then present some results from the Gus Schumacher Nutrition Incentive Program, otherwise known as GUSNIP, Year 2 results specifically for produce prescription programs, and then move on to just a slide on public-private partnerships as a path forward here in Israel. So there's a lot of information on this, packed on this slide. So, and I jotted down a few other notes. So, according to the United States Department of Agriculture, so 10% of our population, or 13.5 million of U.S. households, were food insecure at some point during 2021. And as a result of the food insecurity rates, basically USDA is working, and has been for many years, to end hunger and obesity through the administration of 15 federal nutrition assistance programs. And so I've highlighted just a few. There are many more. But I do want to talk about this because this came up in the symposium yesterday. So our largest program is the Supplemental Nutrition Assistance Program, also known as SNAP, or food stamps, and it's the largest federal food assistance program in the U.S., and it provides timely, targeted, and temporary benefits to low-income Americans to enable them to buy groceries. So in short, low-income households that qualify for SNAP are given an allotted amount of money per month to spend. And again, that varies a little bit, but up to about $210 US, or 717 shekels per month. Then the next food assistance program I'm just going to describe briefly is WIC, and that's for women, infants, and children. And so low-income moms and who have children 0 to 5 and are low-income, then they actually get a monthly benefit, and that equals about $56 US, and that's for the individual, or 191 shekels per month that could be used. The difference between SNAP and WIC at this point, well, WIC is for moms, but that it's essentially restrictive as far as what can be purchased. So fruits and vegetables and other foods, it's geared towards nutritious foods, and SNAP doesn't have that stipulation. And then the moms get nutrition education as well. And then the last food assistance program is TFAB, which is a short-term assistance program, and I put that there because it provides healthy foods and makes them available for the states, and then they're distributed through emergency food agencies like food banks, like Gidi is going to be talking about food bank, and food pantries. So now I'm going to talk a little bit about some definitions around food insecurity and nutrition security. So there are a lot of definitions out there, but the U.S. Department of Agriculture defines hunger as an individual level physiological condition that may result from food insecurity. And then USDA defines food insecurity as a household level economic, I'm saying economic because it's all about access and economic drivers, and a social condition of limited or uncertain access to adequate food. And there's a different definition that comes from the FAO on food security, and that's a situation that exists when secure access to an appropriately nutritious diet is coupled with sanitary environments, so bringing in the cleanliness, adequate health services and care in order to ensure a healthy and active life for all household members, so the healthy part. So then switching to nutrition security, really this has come about more in the last couple of years in this new administration that is placing an emphasis on nutrition security. And the USDA definition for that is all Americans having consistent and equitable access to healthy, safe, affordable foods essential to optimal health and well-being. So it's much more aligned with the FAO definition at this point. So with that in mind, we received some funding from the Walmart Foundation. I did say the Walmart Foundation. It's not who you would think would be a funder in this area, but they're very interested in food access issues. And so we got this funding before COVID, and it was to develop measures that could be used alongside the USDA food security module that would really augment this module. And so we were really excited because it was actually the first measurement study that was funded by Walmart Foundation. And so we knew that nutrition security was this larger concept than food security, and that it encompassed food security, but was also concerned with the healthfulness of food. So the USDA food security module also emphasized nutritional quality of the food. So we set about to basically create new constructs. And these new constructs, the way we did it is we convened an expert advisory committee. This was all happening during COVID, so this was done remote. And then we had a formative phase, and we did cognitive interviewing and psychometric testing. So there was a lot that went into it. And this just shows you the measures. So these are the 3 domains we arrived at. So you could read these. There's a lot here. I'm only doing this, and I'm not doing it justice. But these 3 domains are household resilience, the other 3 pillars that Roni talked about, which are from the international literature, so perceived availability, utilization, and sustainability, and then nutrition security and dietary choice, which was, again, very new. And that 4th pillar of accessibility was not included because it is already included in the USDA food security module. So unfortunately, I don't have time to go through the measures in detail, but I will just say they are psychometrically sound, meaning they have good validity and reliability. And in addition, these measures are independent, so they could be used separately or paired as a set, so depending on the project aim. And then they are also free and publicly available on our website. And if you don't, it's centerfornutrition.org, along with resources on how to administer them. We try to make them as easy as possible. We have short versions of them. And we have one paper that was recently published in Appetite, and another 2 that are under review. And all of those are going into open access journals so that anyone could access them. So a little bit about fruit and vegetable. I've been working in the area of fruits and vegetables for the last 25 years. So talking further on nutrition security, the concept promotes, again, consumption of these healthy foods. Some may argue that fruits and vegetables are the healthiest food. I would say that I'm one of those people. So as far as fruit and vegetable intake recommendations, they're different in the United States. So the Dietary Guidelines for Americans in 2020 recommends consuming 1.5 to 2 cups of fruit and then 2 to 3 cups of vegetables per day, and that varies on age, sex, and 1 cup equals 2 servings. So it used to be 5 a day in the United States, but it changed. Then the Israeli Ministry of Health's recommendations from 2019 recommend 5 servings a day and a variety of colors. So what you could see here is this is probably because of the differing recommendations, but only a small amount of adults in the United States meet the fruit and vegetable recommendations according to data from 2019, and according to the Mabat Nutrition Survey here in Israel, In 2019, a majority met the fruit and vegetable recommendations, but I think, again, because it's 5 a day and ours are now 7 to 13 a day. So, this is my understanding. So I think another reason that the Israeli population may be meeting the recommendations is the difference in access. So it seems that Israeli, at least in my time here, I've been going to different grocery stores and little, we call them bodegas, they're little markets, and there are fruits and vegetables like everywhere, which is really, really nice. And it's not that way in the United States. And so it seems that Israelis have access to fruits and vegetables, but affordability is still an issue in both populations. So financial incentives, what they are, this is what I've been working on for the last several years. So I'm very excited about financial incentives because I think that they could potentially be applied to Israel. So financial incentives for consumers include, they could be vouchers or tokens or any other type of redemption for either low-cost or no-cost fruits and vegetables. So for the GusNIP project, which I'll talk a little bit more about, in the US, there are two main types: nutrition incentive and produce prescription. So nutrition incentives are specifically for people who are participating in the SNAP program or food stamps in the United States. And they're separate. They're essentially an add-on. They're a benefit to their SNAP. And the way that it works is that participants get a certain amount of money each month, and it's usually each month, or actually with nutrition incentives, sometimes it's each week. And they could use these vouchers at participating grocery stores, farmers markets, and other food retailers to get double. It's usually double the amount of fruits and vegetables. So that one-to-one match is amazing. So if someone has a voucher for $10, then they get $20 worth of fruits and vegetables. Produce prescriptions, which Dr. Levine brought up earlier, they're also known as food as medicine. We have all different kinds of names for them. In that case, the participants don't need to be on SNAP, so they don't have to be on federal food assistance. In this case, they visit a doctor or a clinic, and if they screen positive for food insecurity, say with a 2-item screener, and they have a diet-related chronic disease like type 2 diabetes, then they get a voucher or other type of redemption to, again, get either free fruits and vegetables at the clinic, at a grocery store. Sometimes it's a box of fruits and vegetables. So I feel like since you guys don't have a program here that's equivalent to SNAP or food stamps, and because I only had 15 minutes, I'm going to talk more specifically about the program on the right side, the produce prescription. But in general, both of these, so financial incentives really warrant merit as a strategy to increase fruit and vegetable purchasing and ultimately intake. I mean, so we talk about it as a carrot approach, meaning that the consumer choice is enhanced through financial incentives to purchase fruits and vegetables among low-income consumers. And this is in contrast to disincentive programs, which it sounds like is very controversial over here, which it is in the US too, but we've seen work, our sugar-sweetened beverage tax. So those are viewed as a stick approach. So the reason that they're viewed that way is they restrict consumer choice through price restructuring or taxation. So although both are viable to promote healthy eating, at least in the United States, incentives garner bipartisan support, meaning both sides, Republicans and Democrats in the US, like them. And they're currently being promoted by our administration, the Biden-Harris administration, because we recently, in September, actually had a White House conference on hunger, nutrition, and health, and it was the first conference of its kind since 1969. And these have been laid out as like a strategy. So the US is very much behind the idea of using financial incentives, not just through government programs. So I'm going to quickly just go through a little bit, give you a sneak peek of the GusNIP Year 2 results. So the Gus Schumacher Nutrition Incentive Program, the Gretchen Swanson Center for Nutrition received an award from the USDA, National Institute of Food and Agriculture. It's a 4-year cooperative agreement for $31 million. So it's a very big project, and that's for us to run, to be the coordinating center for reporting and evaluation and technical assistance. And so we help the grantees. We have shared measures that they use, so they're all using the same measures for fruit and vegetable intake, for food insecurity, et cetera, so that we could show impact across these programs over the years. So very briefly, again, I'm going to go through these results. So I mean, the bottom line is that they're really showing that they work. It's very exciting. For produce prescription projects, the mean baseline fruit and vegetable intake increased about 1/4 of a cup. That's like good amount, so we're really happy with that. So, you know, it's very hard usually with traditional intervention approaches to actually move fruit and vegetable intake, so this is moving it. And then next, we have some results with regard to produce prescription and food security. So again, we were so excited to see an improvement from baseline to post, and we saw an inverse trend between the 4 security levels from baseline to post test, with high food security increasing the most among participants and very low food security decreasing by almost half. So basically what it's saying is that produce prescription participants reported reduced food insecurity compared to baseline. I only have a couple other slides. So this one, I'm just going to talk a little bit. It's just that we see economic impact within the community. So in addition to all the benefits that I'm saying, there's also the benefit of keeping money within the community. And so with nutrition incentive and produce prescription programs, we saw $41 million kept within the community with an economic impact. And the next year's data, I took a peek, and we're up to over $100 million. So to me, that's, again, a lot. So I'm just going to end with one other slide that describes potential benefits for Israel to adopt nutrition security efforts like produce prescription. So from what I understand, the healthcare system in Israel, it seems like it's less complicated and potentially less restrictive compared to the healthcare in the US. We have HIPAA privacy concerns. There's just using electronic health records is a big mess. So for us, you know, we have that in addition to having a lot of different healthcare systems, whereas you have universal healthcare over here as well. So from my point of view, there's really good potential to promote public-private partnerships to enact these produce prescriptions. So say between NGOs, healthcare, government, and other sectors coming together. But to me, I stand here and I think it's more of an empirical question back to the panel and to others in the room. Given these improvements, given these wonderful things that you're seeing, you know, could these programs be implemented in Israel? And you know, I'd love to help if you need any help with it, but we're really seeing great progress in the US. So with that, I really thank you for your time. I want to acknowledge my other co-authors. And if you have any questions, feel free to ask now or follow up with my email.
Thank you, Amy. And as we heard earlier from Dr. Mackenbach, we are dealing with complex systems, and obviously the food system is maybe one of the most complex. And we are at a time of crisis, clearly not only, of course, the COVID, but with climate change and with the broken food systems around the world. And to this crisis and people in Israel and other places who are with hunger, there is a very important role of the NGOs. And after we heard maybe something like a governmental perspective and something like academic perspective, it's a great pleasure to invite the next speaker, Gidi Kroch, the CEO of the Leket Israel. And beside his personal recognition, which I'm sure he less want me to remind, he is really remarkable in being responsible for overseeing the daily operations of Leket Israel and for reporting to the board and creating this outstanding endeavor. Thank you.
Well, something had to be said about me except being the CEO of Leket Israel, right? First of all, I'm happy to be here, and thank you for joining us. I just, in this context, would like to take 1 second about Dov, which I also learned to love him, I think. He was a great man, actually a mensch, as we say in Yiddish. And it was amazing because we developed a very nice and good relationship, and more than that, I think we have a kind of friendship as well. And I learned a lot from him of how to negotiate, what can be done with the government, what can't be done with the government, and how to approach the government. Not that it helped us, but I think it was very interesting and great scholar and friend. So with that, I would like to talk about the Leket Israel, and just to give like an idea of the organization, what we do. Leket Israel is a food rescue organization, and we're all about nutrition, so all our food is nutritious. We have two main programs, as you see on the screen behind me. One is the food rescue or the meal rescue program, where we rescue meals from lunches in hotels, the IDF. Actually, the IDF is the biggest donor we have for food, and corporate cafeterias or dining rooms. We rescue, this year we're going to be about 1.7 or up to 2 million. We still don't know how it's going to end. We still have a month and a half to go, but it seems like we're going to be in the 2 million mark. Last year we were about 1.7 million meals, and a meal is a meal. No averages and nothing. It's a protein and two sides. That's how we count a meal. The second program, which is probably the largest program, is the gleaning program, where we collect fresh produce from farmers all over Israel and from packing houses. We're probably going to finish this year with 30 million kilograms or 30,000 tons, or whatever the number is, 65, I think, million pounds of fresh produce. We work with about 240 agencies all over Israel, and supply fresh and nutritious food to about 250,000 people weekly. And all this we're doing, unfortunately, by ourselves, reliant on philanthropy and nothing more than philanthropy. And I wanted to talk specifically, I think, more about nutrition and what we do in nutrition and what we serve. So these are part of the numbers that I just mentioned now. And in 2015, I think it was, we parted ways with just the regular collection from manufacturing companies all over Israel, because the food was not nutritious, and also because we thought we saw no edge in it, meaning that all the organizations in Israel are looking for the same flour, oil, whatever it is, and all packed goods. And we didn't want to be one of these organizations. We wanted something to be something different. And that's why I parted ways with that kind of program, and also with a school sandwich or breakfast program that we had. It was very difficult to do it. We spun it out, and now it's a totally different nonprofit. But I'm saying this because nutrition is very, very important for Leket Israel. It's one of the agenda it is the agenda that envelopes everything that we do. Of course, the fruit and vegetables are 100% nutritious, and also, even though there's some 5% processed foods in the meals, it's still very, very nutritious. 8,000 people get meals every day from this program. And we've also developed another program throughout the years, and now we have a soup program that we take the excess of what we have sometimes and turn that into soups. And it's interesting because it started off from a program, or it started off because we had excess that we didn't know what to do with, and then we said, well, let's turn that into soups and salads. And so we had to find a manufacturer, and we did. And we started distributing it to mostly elderly people. And then the report from them was, wow, well, we have dinner now, because apparently a soup and a piece of bread is dinner for the elderly. And it was amazing to see how from our need came a solution for these people, for these elderly people that we distribute the soups to. And right now we're finishing up, the end of the year, we'll be finishing up with 520 units of 500 milliliter soups. And we'll continue that in the next years as well, and perhaps develop some more in this. You can see some more information about Leket Israel, but I think it's probably better to dig deeper into what we do in nutrition. And forget it, it's going to be a lot longer than that. No, I'm kidding. I think as a government, we can, or as the government in Israel, and we as a nonprofit organization, we care about the people we serve, and so should the government. And in doing so, or in thinking this, and if this is the agenda or the idea around it, we cannot distribute food that is unhealthy for these people. Because then again, 20 years down the road, 30 years down the road, you saw the list of, the amazing list of all the diseases that we can suffer from that some of them are related, or most of them are related to some sort of food insecurity or hunger, as we said before. I read a study just a few months ago that the cost of, I'll try and say it right, the cost of not malnutrition, but food insecurity on the health is estimated in Israel about 20 billion shekels. Now, when we say that, 20 billion shekel, that's the cost of food insecure. The whole idea, or the whole problem, not idea, but the whole problem of food insecurity can be solved with about 1 billion shekels a year, using food rescue is probably the most important part of it. So we can solve a problem for 1 billion shekels, and we're spending 20 billion shekels a year annually because of the same problem that we're trying to solve. Doesn't make sense, but it is what it is right now. So moving on to what we do in nutrition, well, I thought we can move on. Click back. There we go. So as an organization, and I said the agenda is very important, so it's not just talk, we also walk the walk in this. And you see that we've actually completed up to now 75% of the nutrition workshop. A workshop is 4 seminars, so that's about, and we're doing 80 of them this year, 100 next year. So that's about 300 days of workshops. 100% healthy food, I said that before. An impact on recipients, that's a question at all. How do we measure the impact of what we're doing? I mean, the whole idea is that we want to, of what a nonprofit is doing, is that they have impact on the population they serve, or on the population that they discuss. And I think one of the places that we see impact is the amount of servings that we do. We're now 41% of the servings, according to the Israeli, what she said. And that's about, if 5 servings, so we're serving about 2 servings of fresh produce a day to these people. That's not enough. Yes, I'm jumping to the end. I think also, and I'll jump into the last slide in this, and this is also what we measure. So we're doing a couple of measurements. A few years ago, I said, okay, we need to study and see what people actually want to consume, or what would they consume more likely than other things in terms of fruit and vegetables, of course, and of course it's the Mediterranean salad. So today, the Mediterranean salad and any piece of fruit and some additional pieces of vegetables, required vegetables, are about 82% of what Leket collects at all. And that's a huge thing, because it means that people will actually consume what we deliver to them. And of course, it's the 5 colors that we're working on, and you can see how the distribution is. It's almost fair to say that it's equal, and we're working on that. Last word, and excuse me for using one more minute in this, is that today we came out with our annual report. If anyone wants to read the report or have it handed out, if Fat, my assistant here, will be happy to do it. Unfortunately, at the moment, we only have a Hebrew report, but we have an English cheat sheet. Try and get an Israeli to say cheat sheet. Well, that'll be a feat by itself. But this, the amount of food wasted in Israel, 21.3 billion shekels annually, and 37%, very similar to other countries in the Western world. Not only the Western world, but very similar to food waste at all in the world. And it's 2.6 million tons annually that we waste. I could go on and on and on, but I think this lovely lady will kill me if I do so. So thank you very much.
Thanks a lot, Gidi, and thanks, Roni and Amy as well. Wonderful speeches and presentations. And I also want to take the opportunity to thank the Taub Center for this remarkable conference. I think we can all give a round of applause to the conference. And before I open the stage for questions and comments, I want to say that, you know, as we spoke about the crisis, but the crisis is also an opportunity. We are a time of changes, global changes, and changes also in Israel with the new government, but this is also a great opportunity for us to put food insecurity to the table. And I met Dov Chernichovsky about 15 years ago, and we worked on several projects, but one of them was about planning for the future Israel, for Israel 2030, and he always had this wonderful optimism and enthusiasm to promote Israel and Israel food security. So without any further ado, please let's get the audience engaged. And if you have specifically, I mean, we spoke a lot about the problems. If you have a direction for better solutions, maybe now it's a good time to share them with us. So please. Nadav, here, the first row. Stand up, then it will walk. מיקרופון? דבר, זה יעבוד, זה קסם כזה. לא, שעכשיו שומעים, לא? טוב, בוא תעלי.
Thanks so much for having all this perspective. Again, I want to share the idea that Taub is committed to continue and do the work. And I'm also sure that somehow Dov is with us, Roni, as you said. We have the discussion of the scientific committee, and one of the main, we're all sure that, and I think it was a recurrent theme today about this need of being multi-sectorial, interdisciplinary, and all of that. I wonder if you can share, all of you, some stories of maybe success or maybe failures. I think it's one of the most important questions right now, and I think all of you were hinting that there are tensions. And here we are, let's say, among friends. We need to remember that there's also I think, Amy, you were the only one maybe mentioning more clearly the role of the industry. That's another tension. So if you can reflect how we are doing it, how we are doing this kind of multi-sectorial approach with so many different definitions and interests. Thank you.
It takes like 5 seconds, so maybe.
Now it is. Okay. So nutrition security, as I said, is a fairly new term in the U.S., and there are some who really want to keep it to be food insecurity, and that has to do with, again, policies. And so there are people in the public health world who think it's very important to go to nutrition security. There are others in what we call the anti-hunger world who are well-meaning and doing great work, but they are worried that if we use the terminology around nutrition security, that then all of a sudden there'll be restrictions on SNAP. So I mentioned how WIC is a very prescribed program. SNAP is not. And so I think people are worried that, if there are restrictions on SNAP, say for sugar-sweetened beverages, et cetera, it jeopardizes the whole SNAP program. So we're dealing with those kinds of tensions right now.
I think it's the same in the National Council of Food Security, that each ministry has his own jargon and discourse of food security, and it's very, very difficult to coordinate all of them. The last discussion was about the minister got subsidies for food substitute for babies. and the Ministry of Health said, hey, you are promoting anti-breastfeeding policies. And we will have this week a discussion about that kind of issues. I think that there are many, many tensions in but I think that we will bring all these groups together. We tried to bring the chains of the supermarkets, big chains, to work with us, with this ministry, around the prices of the cost of living of basic. But even there were many, many discussions. What were the 30 main components of a basket of food that should be addressed? So there are many, many tensions, but I think that we can just put all this in line, because I think that everyone needs a plan, a national plan for food security that incorporate all these different sectors and discourses and agendas, etc.
I think there's a lot of tension regarding nutrition at all. I think when we talk about nutrition, only the professionals really understand what we say. And when we go to the Ministry of Health, they understand perfectly what we say. But when we go out to the public or when we go out to other ministries, sometimes you still get a response like, what does it matter? Let people eat. They're hungry. Let them eat what they eat. And that's why I said earlier in my presentation that I think the government cannot support food that is unhealthy. And that's critical, because today the government does support nonprofits or in some kind of programs that they have, support programs, financial support programs, and then they just go out and buy whatever they think their constituents want. And it's not necessarily what they need. And it's a bit maybe elitistic, and but sometimes as nonprofit organizations that want to pave a new way, we have to work like that, and we have to pave this way. And so I think nutrition is an unpopular word because it's easier to disregard it.
Yeah, thanks. We have the experience from tobacco control, and although food insecurity is very different from tobacco control, and our tension with the food industry is definitely different, despite that, I must say that we have to take into account the commercial determinants of health. And as we learn from tobacco, with steps like the Framework Convention on Tobacco Control, an international convention signed by most countries, and which includes steps like not allowing the industry to rule the policy, and steps in tobacco which include not only monitoring and evaluation and protecting the people, but also ban on promotion, marketing, and advertisement. I think that's a crucial step, because whatever we do, if still the food that is unhealthy, and again, in our opinion, it's not only unhealthy, but it's also on the expense of buying and manufacturing real food, then we lose, because people would buy, because of the advertisement, the unhealthy food. So that's something I think we have to take the step forward. And as Sir Marmot said today, also the sustainability is always part of it. We don't have the privilege to look only at one angle. We have to look at the holistic approach. We may have time for one last question. So yes, please. Yeah, Alex.
Thank you for the talk. I have two questions. Can I squeeze two in?
One last speaker, two questions, sure.
And I'm greedy. So the first thing is, listening to you, I'm sort of seeing my daughters who are listening to you, and they're saying, this is a version of fat shaming. It's going to be very difficult to convince people to eat the right way without making them feel bad about something which they and their families do, and it's deeply. Food is culture, and so that's that's a tension which we always face. The second and more important thing is one thing which hasn't been mentioned all day is the rate of population growth here. I mean, if we have 20% of households which are poor now, and we're 9.6 million people, in 20 years we'll be 12.8 million people. So part of the Leket challenge is to, if you know, please God, we will have solved these problems by then. But there's a growing target every year. Can you maybe say something about that?
So with regard to fat shaming, right now in the United States, there is this whole idea that we shouldn't be measuring BMI anymore. Again, with the idea of fat shaming, I'm one of the people who thinks that if you have a BMI of 50 or you're morbidly obese, that there's something that needs to be done about that because it's not healthy. So I know there's health at every size, but I guess I want to go back to what we're eating, and so ultra-processed food is cheap, it's palatable, it's sugar, salt, fat, and that we're programmed to like that. So as a baby, if you put it on baby's tongue, they love it. So we're fighting an uphill battle with fruits and vegetables. That said, fruits and vegetables can be fun, they can be delicious, they can, so I mean, I think that, it's not a matter of, we don't even talk about, the grantees don't talk about weight per se, they talk about improving diet, specifically eating more fruits and vegetables. So, I mean, to me, I don't necessarily equate that back to fat shaming, but it's a good question. Thanks.
First of all, I totally agree with Amy here, but regarding the question of Leket and the growing population, I think that's a question that should be addressed by the government, not by Leket. Leket is a solution, is one solution of many solutions. We think it's a great solution, but we're biased in this. We definitely can do a lot more than what we're doing now. It's all a matter of funding. And, I always say this, if someone drops, the government drops 100 million shekels on Leket now, I wouldn't have a clue what to do with it. So it's a process it's a controlled growth process that has to go. And Leket is not here to solve the whole problem. We're doing what we can within a very serious problem, and I think the consequences of bad nutrition is here, and it'll be a pandemic in years to come if we don't work on this now.
Just to conclude the session, with this difficult question of one of the greatest environmental problem on Earth is the mass population of humans. That's a fact, and we need to think what we do with it. Tomorrow there will be a publication about global world fertility that you may find of interest. I think that what we didn't say in this, the current session is about the municipalities. I think that what we do in Israel at the local level, so that's another area we need to think about in food insecurity at the local level, the neighborhood level. But I think we left with a lot of food for thought and a lot of encouragement for the intersectorial conference that we had here and the great opportunities to collaborate and to promote food security in Israel and elsewhere. So thank you very much.
Hello, everybody. It's good to summarize. Well, it would be difficult to summarize, but let me just say that if in the beginning of the day I thought that I have a lot to learn, I didn't understand how much I have to learn because everything was fascinating, and I'm coming out really with great reward. I'd like to express thanks to the entire team of the Taub Center who worked very hard in order to achieve this conference that we had today, especially Anat, who worked very, very hard. But not only Anat and Chedva also devoted days and nights. And Laura, Racheli, Yo. I'm sure I forgot other people that ought to be thanked. So I'll say thank you to all of you, and also to Nir. Nir, who has been with us for 3 weeks only. And he already ran this thing in a manner that I could certainly not do it, because he understands the subject at hand much better than I do. Thank you, Nadav. Thank you all. And we will meet again next year, but we'll probably meet before that. Thank you very, very much.